communities often find themselves in what's called a healthcare desert, but new technology is offering a solution to the shortage of primary care physicians here in the Texas Panhandle. KAMR Local 4's Maggie Glenn explains how telehealth is on the rise.
We are facing a national physician shortage.
Dr. Brian Weis, the Chief Medical Officer at Northwest Texas Healthcare System, says the Texas Panhandle is no exception to that shortage.
If you look, a lot of the doctors are coming out of training now are heading to the major metroplexes, and so for a lot of these smaller regional facilities, they're really struggling to recruit providers.
Data from the Texas Department of State Health Services shows 9 out of the 26 counties in the Panhandle have 0 primary care doctors. When you increase that number to 1 primary care doctor or less, it expands to 12 counties. Dr. Weis says telehealth is a growing solution to this problem.
Some of our specialists and subspecialists provide services to those hospitals in a way that is accessible to the patients in those communities, and they can stay in those communities.
Dr. Shane Harper, Chief PA at the Texas Tech Department of Surgery, says there are several ways to implement the technology into the medical field.
Telecommunication could be something that's over a computer at their desk, or even now, even in their phones. So, for instance, telehealth could be where some insurance companies have it. Instead of going to your primary care physician, you can call a 1-800 number and more or less have a FaceTime with someone to provide, something simple, cough and colds.
From there, it's progressed to the point where specialists can see a patient for the first initial appointment and then do all of the follow-ups via telehealth.
For instance, if you live in Canadian, you come and you see, a specialist here, cardiologist or whatnot. Sometimes those follow-up visits are just really 5-minute visits. How are you doing? Is your medication working? And really those are things that can be done just as a face-to-face deal over telehealth modality versus coming all the way down to Amarillo, being here for 5 minutes, and then having to go all the way back to your hometown.
And now the technology can be used for more serious injuries.
We've done teletrauma where someone is acutely injured at an outlying facility. That facility, if they're set up with us, can go ahead and link up with us, and we can see via very sophisticated FaceTime that patient in real time. So we can, see the patient as they're in the ER, help that primary care doc or that ER doc in that small town get that patient stabilized for transport here to Northwest.
Advancements in technology are not the only reason telehealth has seen such progress in recent years.
There's been some key changes in regulations at the federal level that now allow for billing of these telehealth services.
I authored and passed some telemedicine legislation that broke down some significant barriers for providers to get paid by health insurance companies.
Representative Forprice has been fighting for solutions to the rural healthcare problem for years. He says the technology brings hope for the future of healthcare in our area.
Healthcare is, an issue that's always in the top 2 or 3 of what we deal with. It is now one of the largest areas of our state's expenditures and a very large $250.7 billion budget. So I'm encouraged, though, that we'll find creative, efficient, and better ways to make healthcare more accessible.
In Amarillo, Maggie Glenn, KAMR Local 4 News.
Telehealth services also include psychiatry and dermatology. Dr. Harper adds he hopes that the technology can soon be implemented in ambulances as they make a long trek with patients from surrounding communities and feed that data back to the ER here in Amarillo before they even arrive.